Does this look familiar? Do you have low back pain? And have you been rolling out your low back in order to help yourself? Well, chances are not only are you rolling out wrong, but you're probably increasing your low back pain. Hey guys, I'm Dr. Josh. In today's episode, we're gonna talk about rolling out your low back pain. And in order to get better, we're gonna show you how to do it properly and how you can do it better so that you can actually get results. So the problem with rolling out lower back pain is that most people will put the foam roller directly underneath the low back and the spine, and it looks like this. Now, in this little diagram here, it may not look so bad, but what you're doing here is that the foam roller is just too large and it's too big and it's not designed to go underneath the lumbar spine or the lower back. Now, this can go up into the mid back because you have the ribs here to secure it. But if you place this down into the lower back, you can see how it adds a exaggerated curvature. Now, we're supposed to have a little bit of a low back curvature, but we're not supposed to be like this. And this can compress the facet joints. It can add a lot of tension and a lot of compression to the lower back. Now, if you have a sciatica or disc herniation, stuff like that, and you might find a little bit of extension helps you, but again, this is too much extension. Now, if you have a facet issue, maybe you're having stenosis, or maybe you're even dealing with a spondylolisthesis or a slippage of the lumbar spine, this is actually one of the worst things you could be doing, and you could be accelerating damage, and you could be delaying your recovery, and you could be causing a whole host of issues. And if you're having sciatica, a lot of times people will move that foam roller into different locations, and we're gonna show you how to actually deal with that as well. But anyway, the foam roller underneath the low back is absolutely something you should avoid, and you're probably causing yourself some issues. So what can we do instead using the foam roller, and what can we do to help you help yourself? So one thing you can do, instead of going directly onto the spine, we can go onto this lower back part and the thick part of our lower back, right? These are really thick, dense muscles, and they can really do very well if we put compression onto them. So what we're going to do is, instead of going onto our back, we're going to slightly lean at like a 45-degree angle, just like this. And we can use our arm and our elbow and our legs to help roll out. We could even stay in that one position, like kind of near that QL. We can open up and roll side to side. We can get a little bit of movement in here. In addition, we can use the foam roller into other areas of our body. To show you what it looks like on the lower back on this side, again, here's up and down. This is what a big no-no is. This is what we're gonna do, is we're gonna roll to the side, and we're going to do this. I like to have my arm here supported on the ground because I don't like to put too much pressure into the ribs and cause some other issues here. And all I'm doing is getting a nice little mini massage into our lower back. Again, we can use this onto our hips, because the ultimate goal when it comes to lower back pain is to learn how to mobilize the hips, because the spine needs to learn how to stabilize and be more secure, but the hips need to learn how to be mobilized. So if you can look somewhere else or search somewhere else for some restrictions and some tight spots, you can definitely go down and into the thighs and into the hips. So we can do the quads, we can come up here and we could do a little bit of adductors, we could do some hip flexor stretches, heck, we can do the hamstrings. But another big mistake that people do when they come in and they're like, I've been rolling out my piriformis, they've been rolling out these other issues, what they're doing essentially is they're taking the nerve that goes down into this direction and they're stretching it, right? So when they do stuff like this, and I'll show you what it looks like on a foam roller, we're coming here and we're stretching it like this, right? We're stretching the piriformis here, and then we're essentially elongating some tissue. When you elongate it and then you compress it, you're causing a lot more discomfort or irritation to the nerve. In addition, when you stretch tissue just like this, you're making it thinner and longer. So it's actually easier to get in using the foam roller. Now, a lot of people will use a tennis ball or a lacrosse ball as well, and they'll do the same thing. But what you're really doing in this type of case is you're actually creating more compression and more irritation, because an irritated nerve that's zipping down your leg and causing a lot of pain does not like to be compressed, it does not like to be irritated, and it does not like to be pissed off more. And if you keep doing this, you're just delaying your recovery. So these are a few major mistakes that I see as a result of this. And what you really want to do, instead of putting direct compression onto the lumbar spine causing more issues, or direct compression onto the sciatic nerve or piriformis issue, is you really want to start using the ball or the foam roller in other areas. You could do mobility drills into the hips, or if you're really sore and you're really unable to do some of these activities, what you could do is literally just do very gentle stuff, not compressing the nerves and not compressing the legs and not compressing the tissues aggressively, especially that nerve. Again, you can move this onto different parts of the hips, coming up and down. You can get into the quads, and you can get into the adductors, just like here. And you could definitely do any other area, and you could definitely do any other mobilization. But again, causing more compression and more irritation is actually going to hurt you long term. And we find in our office, as well as with our patients online, some of the things that they're doing is actually causing their pain and making them get worse or not get better at all. So you could be doing all the right stuff, but if you're doing a few of the wrong things, this can cause you to stay still and stagnant and not progress in your rehab. If you're somebody who's still dealing with lower back pain and you found this helpful, make sure you download our free low back pain relief guide. These are our top exercises of things that you could do to not only help your low back pain, but we also provide things that you should do to avoid lower back pain as well. So if you found this helpful, make sure you subscribe to our channel, and we'll see you for the next episode.